Ano nga ba ang ugat? Ugat in English, vessel. Maaaring ugat sa pinagmulan. Ang pinag-uugatan ng lahat. Ang isa sa mga pinakamahalagang tagapagdaloy ng buhay o sa Ingles ay pwede ring blood vessel or vein and artery. The root of life. Pero ano ba ang pumoprotekta sa ugat? Ang inner layer nito ay tinatawag na endothelium. Sa definisyong Ingles, a thin membrane that lines the inside of the heart and blood vessels. Endothelial cells release substances that control vascular relaxation and contraction, as well as enzymes that control blood clotting, immune function, and platelet adhesion. Sa madaling salita, ang linya sa loob ng ugat ay kumokontrol sa normal na pagdaloy ng dugo sa mga ugat na siya rin nagdadala ng kalusugan sa buong katawan. Kailangang mapanatili na malusog ang endothelium para maging normal ang ating mga ugat. At kapag malusog ang ugat, malusog din ang buong katawan. Your very own organizer. Your very own reminder na please, relax ka lang. Pero minsan, hindi maiiwasan na ma-overwhelm tayo sa mga bagay-bagay. Paano pag di na kinaya ng endothelium mo dahil sa mga gawain mo? Risk factors? Tulad ng sedentary lifestyle, lack of exercise, eating unhealthy foods, high-fat foods gaya ng chips, soft drinks, at iba pa na pwede ring magdulot ng high blood pressure or obesity. Samahan pa ng paninigarilyo. Paano na? Isipin mo rin si endothelium na nagtatrabaho ng libre sa loob ng katawan mo. Kaya tulungan mo ang iyong endothelium. Maintaining a healthy endothelium is a vital strategy to prevent adverse vascular outcomes in pre-COVID and COVID era. We're honored that when you think of vascular health, you think of Vessel F. Deserve rin ng endothelium mo ang protection mo. Happy endothelium is equal to a Juper happy and healthier life. Vessel F, where better endothelium begins. Powered by Corebridge Group Philippines Incorporated, bridging healthcare to people.
To give us his opening message, let us all welcome the President of the Philippine Society of Vascular Medicine, Dr. Jonathan James G. Bernardo.
Noong nakalipas na taon, isinagawa ng Philippine Society of Vascular Medicine o PSVM ang isang information drive na pinamagatang Ugat Serye. Tinalakay dito ang mga iba't ibang issue na may kinalaman sa mga sakit sa ugat para sa impormasyon at kaalaman ng ating mga kababayan. Ito ay ang pagsasatupad ng isa sa mga misyon ng aming organisasyon na ipamahagi ang mga mahahalagang kaalaman ukol sa kalusugan ng ating vascular system o mga ugat sa katawan. Dahil sa success o tagumpay ng programang ito, sinigurado ng PSVM na maglunsad ng karugtong na kabanata, ang Ugat Serye 2. Patuloy nating tatalakayin ang mga mahahalagang issue ukol sa kalusugan na may kinalaman sa vascular system. Sa tulong ng ating mga mahuhusay na mga manggagamot at tagatalakay, lalo na rin sa ating mga kilalang panauhin na bukas loob na nakibahagi sa programang ito, ikinagagalak ko na muli nating ilulunsad ang pangalawang kabanata ng Ugat Serye. Sana'y maging malaking tulong ito sa inyo, sa aming mga pasyente at kababayan sa pag-iwas sa sakit at mga komplikasyon ng sakit sa ugat o vascular diseases. Tayo na't makinig, matuto at magalak sa aming diskusyon at palitan ng kuro-kuro. Ito na ang Ugat Serye Part 2.
Good day everyone, welcome to our Ugat Serye. This time, we will be talking about peripheral artery disease. Just now, we were presented with a case of a 69-year-old male with multiple risk factors including smoking, diabetes mellitus, an elevated cholesterol, hypertension, obesity, sedentary lifestyle, and a strong family history of vascular disease. He came in for consult due to claudication after walking a distance of 300 meters. Upon physical examination, the ABI was less than 0.7, which is already suggestive of peripheral artery disease. Now, peripheral artery disease, or PAD, is an atherosclerotic vascular disease of the lower extremities. Patients with PAD commonly have associated atherosclerosis in other vascular bed, oftentimes manifesting with signs of active or past history of coronary artery disease and cerebrovascular disease, among others. Patients with PAD also has a high risk for heart attacks, stroke, and death. The prevalence of PAD rises with age and affects a substantial proportion of the elderly population. It ranges with 6% in persons 40 years and older and around 15 to 20% in those 65 years and older. It also occurs more common in men than in women. Reported PAD prevalence rates in the Asia-Pacific regions have ranged from 5% in the Philippines, 5.2% in Thailand, 8.2% in Singapore, to 10.1% in Australia, and 12.1% in Japan. The risk factors of PAD include those individuals more than 65 years of age, those individuals 50 to 64 years of age with presence of atherosclerosis such as diabetes, history of smoking, hyperlipidemia, hypertension, and a history of chronic kidney disease or a family history of peripheral artery disease. Also, those individuals less than 50 years of age with diabetes and one additional risk factors for atherosclerosis as mentioned. Another are those individuals with known atherosclerotic disease in another vascular bed. And lastly, those individuals who belong in the indigenous Australian ethnicity. Findings in the history and physical examinations that are suggestive of PAD include symptoms of intermittent claudication or effort-induced calf or leg pain that is relieved by rest, non-joint related exertional lower extremity symptoms that is not typical of claudication, an impaired walking function, or it can be ischemic rest pain. On the other hand, signs of PAD are as follow: abnormal or weak lower extremity pulses, presence of vascular bruit, non-healing lower extremity wound, lower extremity gangrene, loss of hair, brittle nails, extremity atrophy, and a positive Berger's test, which is defined by pallor of the involved leg after elevation from the supine position, followed by erythema or rubor of the said leg when it is placed in a dependent position, and this often indicates an advanced or extensive disease. The first two are strong predictors of PAD. For the approach to diagnosis, history and physical examinations are the initial steps in approaching patients suspected of PAD. For those patients found to be increased risk of PAD or those with history or physical examination findings suggestive of PAD, an initial ankle brachial index or an ABI should be done. ABI has good validity in the diagnosis of PAD with more than 90% sensitivity and specificity, and a cutoff value of less than or equal to 0.9 is diagnostic of PAD. Meanwhile, an ABI value of more than 1.4 indicate arterial non-compressibility leading to falsely elevated and unreliable ankle pressures due to medial arterial calcification, which are commonly seen in patients with diabetes and chronic kidney disease. Additional tests are needed, such as the toe brachial pressure index or the TBI, and the TBI of less than or equal to 0.7 is considered diagnostic of PAD in these patients. The ABI is performed by measuring the systolic blood pressure from both brachial arteries and both dorsalis pedis and posterior tibial arteries after the patient has been rested in the supine position for 10 minutes. The systolic pressures are taken using a standard blood pressure cuff and recorded with a handheld 5 to 10 megahertz Doppler instrument. It is recommended to begin with the right arm, then the right leg, followed by the left leg, then the left arm, and most importantly, repeating the measurement in the right arm. This practice will mitigate the white coat effect on blood pressure measurement. An ankle brachial index is then calculated for each leg and is determined by taking the higher pressure of the two arteries at the ankle of one side divided by the higher of the two brachial systolic pressures. For those patients with equivocal or normal results, an exercise ABI may be useful. A 25% or greater decrease in the ABI after exercise is considered diagnostic of PAD. Other alternative tests, aside from the two brachial index in the setting of non-compressible vessel, include continuous wave Doppler signal, segmental pressure and pulse volume recording, perfusion pressure testing, and arterial duplex ultrasound. For the treatment of PAD, the management of intermittent claudication generally includes initiation of antiplatelets, such as aspirin or clopidogrel, and statin therapy for decreasing the risk of cardiovascular events, the use of cilostazol to alleviate symptoms of claudication, and exercise rehabilitation to improve functional status and quality of life. Control of other comorbid risk factors is also important. These are continued for 3 months and reassessed thereafter for symptom improvement. Revascularization is then generally reserved for those who have lifestyle limiting claudication despite optimal guideline-directed medical therapy. The choice of revascularization procedure will be determined by the extent of the arterial disease, which may be classified as either a task A or B lesion, defined as short segment unilateral arterial stenosis and managed with endovascular repair, or a task C or D lesion, which is indicative of a more extensive involvement and is treated with surgical revascularization. Critical limb ischemia is the most advanced stage of peripheral artery disease, which manifests as severe ischemic rest pain in the affected extremity and presence of non-healing ulcer or tissue necrosis or gangrene. The diagnosis of critical limb ischemia is based on either an ankle brachial index of less than 0.4, an ankle systolic pressure of less than 50 millimeters mercury, a toe brachial index of 0.7 or less, and a toe systolic pressure of less than 30 millimeters mercury. The management of critical limb ischemia starts with the control of infection by initiating broad-spectrum antibiotics and wound care, followed by imaging studies such as arterial duplex scan or angiography for anatomic assessment, and to triage which of these patients would undergo either an endovascular repair or a surgical revascularization. Thank you.
Hello everyone, magandang buhay po sa inyong lahat and good day sa inyong lahat, no? Wag po kayong magugulat, hindi po ito episode ng Jojo All the Way, ha? Pero all the way pa rin po tayo. All the way to your heart. Literally, the way to your heart. At ang daan doon ay sa inyong mga ugat. Kita naman ninyo sa video kanina, ang pinag-uusapan po natin ngayon ay tungkol sa ugat. Hindi po ugat ng orchid. Hindi po ito pang plantitas, ha? Tandaan niyo yan, ibang ugat po yun. Pero ito po ang ugat na diretso sa inyong puso. Ugat ng dugo nating lahat, ugat ng kalusugan, ugat din ng sakit pag napapabayaan. This is Ugat Serye 2. The second in a series of discussions, interaction, and talk events that are here to help us lead a healthier lifestyle, specifically with our ugats. This campaign is brought to you by the Philippine Society of Vascular Medicine. PSVM aims to raise awareness and learning in our medical and local community and the general public regarding arterial, venous, lymphatics, and any blood vessel concerns. Gets nyo? In short, kahit anong konektado sa ugat, dun po tayo. Kaya nga to, Ugat Serye. But first, sa mga millennials, sa mga Gen Z na hindi ako kilala, let me introduce myself. My name is Jojo A, all the way. May Alejar sa dulo yan. And I will be your host program for this serye. I'm happy and honored that the Vascular Society invited me to this serye. You know, I'm surrounded with cardiologists and vascular specialists, yung mga magagaling talaga. And hopefully, marami tayong matututunan at sana we can apply this in our daily lives. So, back to business. First, a backgrounder. Actually, the PSVM calls this Ugat Serye 2. Because the society had Ugat Serye 1 last year, which was a great success, so they decided that we all deserve a part 2. Now, don't worry. Like part 1, our part 2 is a very short program. Pero sapat na po ito para masagot ang inyong mga tanong tungkol sa napaka-importanting health issue na ito. Today, we shall be discussing peripheral arterial disease. In layman's terms, baradong paa. Yan, nakikita natin ang ating mga paa na nangingitim, sumasakit ang ating legs, baradong ugat po yun. This was shown in our video animation and our dear Dr. Weng Simoun also gave a great lecture. She then applied the learnings on an interesting case. She further dissected the condition and gave different approaches for the treatment of peripheral arterial disease. I'll be honest, no? Sobrang daming alam ko dito na wala na bigla silang lahat. Kaya hindi ko na naintindihan. You know, too much knowledge is too much power. Biro lang po. Actually, kaya naman ako nandito ngayon para malinawan sa ating mga Q&A. Marami tayong mga inimbita talaga na napakagaling. Marami po tayong mga tanong sa ating chat box and text. Pero pag sinagot ko, baka mapahamak lang kayo. Kaya ang nirecommend ko na lang, putspan nyo na lang o ipatawas nyo na lang yan. Hindi po scientific at factual ang mga sagot natin. Mas maigi yung mga expert na. So I'm so glad I have a friend here to help me answer all these questions. Please welcome the section head of the vascular section of Medical City and a member of the Philippine Society of Vascular Medicine, the charming and beautiful Dr. Gina Alemany. Dr. Gina, thank you very much for making time. You look very fresh.
Thank
you.
you.
Look, talaga naman. How are you feeling today? You're good?
I'm good. It's nice to be here today.
Well, the pleasure is all ours, Dr. No? So, ayan naman, Dr. Gina, ha? Napaka-beauty naman natin itong araw na
you.
to. Ha? Thank you very much for making time. Ha?
Thank you, Jojo. Yes, good day to all. I'm excited because this would be another sharing and learning session for everybody. Sana masagot ko lahat ng tanong i-question ngayon today, no? And hopefully, walang tanong sa geography at physics.
Naku! Alam pa man din namin, miski geography at physics, alam namin, kaya mo pa rin sagutin, Doktora.
Naku, hirap yata yun.
Hindi, pero wag kayong mag-alala, Dr. Gina, because tinanggal ko na sa script yung what is the capital of Bulgaria.
Oo, kasi hindi kita masasagot.
Oo nga eh. Actually, alam mo naman yun, alam ko eh.
Pero hindi.
Di ba? So, ito, lahat ng mga tanong namin would be about the Ugat serye natin, no? So, the first question, para lang po, straight from the source tayo, what is the service that Ugat Serye provides?
Well, Ugat Serye is a program that was designed by the PSVM to provide learning and awareness of different peripheral and vascular diseases. It enables our fellows, specialists, physicians, and the whole medical community, and even a simple layperson to understand the diseases of the ugat. This is a venue to make more people more knowledgeable about the disease that can be prevented. Kasi naman, the best way to prevent a disease is to understand what are your risk factors, and then you commit to a healthier lifestyle and avoid these diseases. Lalo pa ngayon, medicine is too expensive nowadays. Gas prices has gone up so high. So before anything else, prevention is always key.
Right.
So that is what Ugat Serye is all about. Better vascular health for doctors and people.
Yeah naman, galing. Well said, Dr. Gina. I'm sure you're so proud with the society, and thank you very much for the society also, no, for this unselfish service. So, diretso na tayo sa ating mga tanong tungkol sa PAD. Yan. The most common question, Doktora, is paano ko malalaman na mayroon akong peripheral arterial disease?
Okay, that's the most important question. That's, it's a common question that's being asked by layman. Paano mo ba malalaman, no? Well, it was well discussed by Dr. Weng earlier in the discussion, no, in her lecture. And let me emphasize the warning signs. Kapag may bara ang ugat mo sa legs, normally you would have pain, no, either resting, but commonly when it's starting pa lang, it's a pain on walking. Mapapansin mo habang naglalakad ka, sumasakit na yung leg mo. Other physical signs that you might notice is that makintab yung legs, lumiliit, walang hair, no? So those are the common signs. At kapag tinignan mo, in severe cases, medyo umiitim sila or maputla ang legs. Tapos wala kang makapang mga pulse or pulso sa legs or sa paa. No? So those are the common signs. Sometimes it comes to a point na malamig. No, when you touch it, it's very cold. It's not warm, the usual warm that we feel. Kapag merong bara ang ugat mo sa legs, kadalasan malamig siya pag tinatch mo.
Oh, okay. Cold feet.
Cold feet.
Cold feet,
Yes,
So
yes.
that's one of the common
Symptoms
Symptoms,
and signs. Right.
Hindi naman yan yung mga hindi natuloy, yung mga pag-aasawa, hindi natuloy, nag-cold feet. Iba yun, no?
Iba naman
Iba yun, oo. So, pero parang lahat ng iba dyan, parang nararamdaman ko kasi lagi ako sumasayaw, doktora eh.
Okay.
Oh, so dapat pala, titignan ko na rin yun, no?
But if you're very active, if you lead a healthy lifestyle and you keep on exercising your legs, you're very far
I'm
away
good.
from
Good.
You're very far away from getting PAD.
Pero seriously, yun naman pala, no? Kahit di tayo doktor, we can recognize by ourselves if we have this problem. Kasi may mga telltale signs naman pala, no,
Correct.
doktora? Mahirap nga lang kasi common yung mga symptoms. How do we know it's not just pagod after workout or baka naman malamig lang yung aircon sa gabi, di ba?
That's
And all these
correct.
things, no? Kaya tayo nanlalamig, doktora.
Well, dapat alam mo yung risk factor mo as a patient, no? Kung ikaw ay hypertensive, diabetic, mataas cholesterol, mataba, naninigarilyo, these are risk factors, no? Pag alam mo meron ka niyan, alam mong meron kang risk factor for developing PAD. And with that, na alam mo nang meron kang risk factor, pag may mga ganong sinyales ka nakakaiba, simptomas nakakaiba, dapat magpatingin na. Hindi to pwedeng baliwalain at sabihin aircon lang or napagod lang.
right.
Dapat may consistency. If you notice consistency in the symptoms, like every time you walk 6 meters or the longer
Yes.
that you walk, you feel the symptom, then that's a signal for you to worry na hindi lang to aircon or hindi lang to pagod kasi
yes,
consistent siya.
Tama.
No, every time you do the same activity, you feel the symptom. It's not just related to the aircon or
that's right.
being tired, but every time you walk, there is consistency that there is pain on walking, and pag nagpahinga ka, bigla siyang mawawala.
Oh,
And then when
okay.
you start
Yes.
walking again, it's there
Andun
again.
na naman.
Oo.
I remember my grandfather, doktora, who's also a doctor, no? And he said to us, sabi niya, kayong unang-unang makakaramdam. If there's something out of the ordinary, you go consult with the doctor agad.
Correct.
Di ba? Kailangan malaman agad ng doktor mo.
That's right.
Kaya,
Hindi pwedeng i-ignore mo lang, lalo na pag alam mong may mga risk factors ka
That's
at
right,
you're
that's
very
right.
prone to these kinds of diseases, no?
Galing. Okay, ito naman po ay tanong ng doktor. Let's go now to the Q&A, doktora, no? Tanong naman po ito ng isang doctor natin from the province. What if we don't have a sophisticated diagnostic testing center in our place? What can we do?
Yes, that's really a big problem in the far-flung areas, no? Wherein there are no diagnostic tools that we can use. Now, para sa mga areas na walang facility, madali naman eh. History, PE. The doctor should go back to the basics, no? History, magandang history ng pasyente, ano ba yung simptomas, how does it progress, no? Pangalawa, titignan mo yung physical exam, no? Examine mo mabuti yung pasyente, titignan mo yung mga pulso, at from there you can get clues to the diagnosis na ito ay maaring sinyales or maaring indikasyon na meron ng pagbabara sa ugat ng paa. So, una, history, PE. Pangatlo, syempre, kailangan mo ng diagnostic test. But we do understand that in the far-flung areas, these are not always available. So, combined with history and PE, then you have the basic test that you can do. The basic test, Jojo, is simple palpation, ganyan. At saka yung diniscuss ni Dr. Weng, yung ankle brachial index. It's a simple blood pressure of the arm, comparing it to the blood pressure of the leg, and then computing for the ratio. And the number that it gives you more or less tells you if you have the disease or not. So a number less than 1 more or less tells you, ay mukhang may problema to. Need further testing or imaging. And then you start referring to a center with the facility. But a simple blood pressure of the arm and a simple blood pressure of the leg, no, using a handheld Doppler can actually detect whether you have a PAD, no, or screening tool. Pangalawa, yung ultrasound common na yan sa probinsya.
Meron na, no?
Ang problema lang, yung mga gagawa. But we do have some vascular techs already that can do this in the provinces. A simple venous duplex scan or arterial duplex scan, no? Yun yung parang ultrasound ng legs can already detect whether you have blockage sa paa. So those are simple tests and simple things that we can do in the far-flung areas, no? Na walang complete facility.
Wow, galing, ano? You go back to basics, no?
Yes,
history and PE. Immediately pumasok sa akin, babalik na naman ako sa history, it will repeat itself. I'm not kidding, Dr. Wow.
I hope it doesn't if it's a bad history.
Oo nga. Pero tama ka nun, Doktora. When you think about it on a practical point of view,
Correct.
you have to miski sa family history, kasama na ba yan, Doktora?
Oo,
Family
syempre.
history nyo, no, of
Oo.
sicknesses, no? Especially pagdating sa mga ugat, no? Oh, okay. Wow! Mga doktor nang bahalang makintindi niyan. Pero kuha ko naman more or less, Doktora, no? That any doctor can be resourceful and make a diagnosis even with simple equipment na abot kaya kahit saan ka pa. Pero balik muna tayo sa mga laymen na tulad ko, Doktora. Another question that came in, no, which came in. How can I prevent having peripheral arterial disease?
Okay. Parang basic yung answer dyan eh. The most common risk factor for PAD, no, is smoking, no?
Uy.
So if you're a smoker, first thing you need to do, stop smoking.
Yeah.
Pangalawa, syempre, kung alam mong may diabetes ka, may hypertension ka, obese ka, mataas ang cholesterol mo, dapat ayusin mong lahat yon. So in other words, una, lifestyle change.
Lifestyle.
Lifestyle, lifestyle. So that includes proper diet, exercise, and health, smoking cessation.
Smoking, yeah.
And then on top of that, of course, you take your medications and you make sure that you manage your hypertension, diabetes, and all your comorbidities so that you don't, you prevent progression, no, of PAD.
Oh, so talagang early detection is best.
Of course.
Lagi, no, Doktora? Okay, so pero pag nagsimula naman po yan, once we develop peripheral arterial disease, what is the likelihood of amputation? No? Medyo mabigat, Doktora.
Oo, pag pinutol na yung paa.
Oo nga, kasi napansin ko rito sa ating animation last time, meron na putulan ng, maaring umabot sa putulan ng paa, no? Medyo scary and depressing for some people, especially for those like me who dance a lot.
I know, right?
Wala yung ganun-ganun ko,
Yeah.
Nora. Siyempre, inaalagaan ko to,
Can
no?
be life-changing when
That's
you
right.
lose your leg.
Exactly. So anong dapat na gawin dyan, Doktora?
Okay, what is the chance of amputation? That's a very common question, no? Kapag may problema ka na at alam mong may problema na yung ugat mo sa paa at alam mong barado na, no? And usually these are the patients who would have symptoms, very bad symptoms. The rate of amputation in patients with very severe pagbabara in the ugat in the leg is about 30% in about 1 year. Mataas yan. And it's very life-changing. It's, like you said, it's very depressing, no? So, yun. Mataas. So, ano yung tanong mo? How
How can we prevent it from happening?
How do you prevent it from happening? Like I said, no?
Kanina.
Lifestyle change, take your medication, and manage your comorbidities. Of course, exercise helps.
Exercise, right. So
Dance
it's
more.
yung the old adage that goes tawag dito, an ounce of prevention is always better than a pound of cure.
Correct.
Diba?
Pero pag meron na, yun yung pwede nating mga gawin, no? Aside from those preventive measures, but once you have it, since mataas yung rate of amputation, meron namang treatments na pwedeng
treatments.
i-offer. Oo, meron tayong mga antiplatelets. Yung mga binibigay ng doktor nyo na blood thinner, that's very important. 2, yung cholesterol, which is the statin, yung mga statin na yan, atorvastatin, rosuvastatin, and all that. And then meron ding mga interventions in certain cases, pero hindi lahat is a candidate for intervention, no? When I say intervention, yung gagawa nila ng, bubuksan nila yung mga bara, no? So some patients are candidates for that, but not all. So aside from medications of blood thinner, statin or cholesterol medication, pain medications for the pain, then you can also have those interventions. But those interventions like bypass, no?
Right.
Kung may bypass sa puso, may bypass din sa legs.
Meron din sa legs.
Oo, pareho.
Wow.
So yung ugat sa puso, yung straight from the heart, diba, sabi mo nga, yung ugat sa puso, ugat sa legs, magkakaduktong yan. So kung ano yung gamot mo sa puso, ugat sa puso, yun din most likely, yun din yung mga gamot na ginagamit namin sa ugat sa legs. So, basically blood thinners. So yung angioplasty at bypass, meron din sa paa
Meron
yan.
din sa paa.
Oo, hindi lang sa
okay.
puso yan, pati sa paa. So, but, like I said, ibang puso, ibang angioplasty sa puso, iba rin ang bypass sa puso kesa sa bypass at angioplasty sa legs. So, yung sa legs, katulad din sa puso, tinitignan namin through an angiogram para kung malaman, or ultrasound, pinagpa-partner namin yung mga test na yan, and then tinitignan namin ano yung pwedeng option na pwedeng i-offer sa pasyente. Like bypass, pwede, or angioplasty. But like I said, no, hindi lahat is candidate for that. No? So, yun yung mga pwedeng treatment sakaling magkaroon na kayo ng mga problema. On top of that, you can also do vascular rehab. No?
Vascular rehab.
Yes. Ang vascular rehab naman, nire-rehabilitate mo, no? Lalo na sa mga pasyenteng hindi mo na kayang i-bypass, hindi mo na kayang i-angioplasty, or na-bypass mo na-angioplasty mo na, nabigyan mo na ng lahat ng medications, and yet, may symptoms pa rin yung
Yes, right.
pasyente. Hindi pa rin optimal on your repeat screening or repeat testing. Then you ask them to do vascular rehabilitation. Wherein you ask the patient to keep on dancing.
That's right. Kailangan nyo na talaga.
Kailangan yun.
Oo, no?
Or you keep on walking so that the arteries will open up. No? So that yung mga maliliit na ugat, magbukas muli.
That's
No?
right. Oo. Kailangan ng a lot of patient, dyan, no? Patients and patient, tawag doon, doktora, yung kailangan focus.
Focus.
Oo, di ba?
Yes.
Kailangan
And all
yan,
these
no?
treatments are complementary,
That's right.
Jojo. So medicine, lifestyle change, management of comorbidities, vascular rehab, and then yung intervention. All together, collaborative effort.
I'm now breathing a sigh of relief kahit paano. Makakasayaw pa ako ng
Ay,
dire-diretso
oo, kahit magkaroon ka ng bara. Pwedeng-pwede.
Pero nabanggit na natin, Doc, yung no? We have another question here. Do we have vascular rehabilitation here in the Philippines?
Yes,
All
absolutely.
set up?
Yes, all, absolutely, no? Maybe not everyone is aware, but all big institutions have vascular rehab, no? And you can always refer to vascular rehabilitation doctors to manage these patients. Either wala pang intervention or may intervention, they are good candidates, all good candidates for vascular rehab. It's basically parang supervised vascular exercise. So may nagbabantay sa iyo habang ginagawa mo yung exercise. Make sure di ka madapa.
That's correct. Galing naman pala. You know, no matter how serious it is, friends, no? Kahit ano pa man yan, lagi may pag-asa. Naku naman.
Correct.
I'm enjoying so much with our conversation and our dialogue. Ang dami ko natututunan, doktora, ha? But we don't have too much time left. So, my last question na lang po, doktora, no? Itong intervention, bypass or angioplasty, which is better?
You can't say because not one size fits all, no? Eka nga, like nabanggit ko kanina, hindi lahat ay candidate for these interventions. Merong mga pasyenteng candidate for bypass, merong mga pasyenteng candidate din for angioplasty, no? So depende kung anong makita sa imaging, kung gaano kahaba, no, kung asan ang lokasyon ng bara, then that will give us an idea kung ano ba yung dapat na intervention sa isang pasyente. Ito ba ay candidate for bypass or pwede ba tong angioplasty lang?
I
No?
see.
So it really
Okay.
depends.
To each his own.
Correct.
Okay, para pa lang yung basketball team, everyone should be involved in winning over the disease, no? So before we wrap up, any parting words, Dr. Gina?
Parting words, keep on dancing.
Ow! Oo nga, no? Para, that is on a personal note, ha?
And keep on walking.
Oh, tama. Eh, totoo ba yung doktora, no? When you say daw one of the best exercise daw ever is free. You don't have any, you do not need or it does not require equipment. It's just walking.
That's correct.
Huh?
Yeah, 10,000 steps.
10,000 steps, huh? Oh, okay. Very good. Thank you very much, Dr. Gina. And I'm hoping that we will be together again in the Ugat Serye very soon.
Next time we dance together.
We should, no? Parang opening natin yun, Doktora, no?
Correct.
Friends, that ends our short Q&A. Let me extend my sincere gratitude to you, Dr. Gina. And thank you din po to PSVM for letting me host today. It was fun and also a learning experience for me. At ang dami kong nakilalang mga doktor here. Napakagaling talaga, no? At marami na rin ako matatakbuhan. Masasayawan.
Correct.
Hopefully, even the layman in our audience may napulot na hacks tungkol sa pangangalaga at napaka-importante pero hindi natin masyadong mapapansin na parte ng katawan natin, ang paa. If you have some more questions, please send them to PSVM and they will answer your queries via DMs. No? Once again, ito po si Jojo Alejar, Jojo A, all the way for Ugat Serye 3. Ay! Next pa pala yun. Ano lang ako? Looking forward for the next Ugat Serye. So maraming salamat po muli. Hanggang sa susunod na Usapang Ugat. Thank you. Have a good day. God bless everyone.